Hello, my name is Dr. Diwan S. Raja. Today I will discuss a few multiple choice questions in drugs for the treatment of heart failure. Let's start the multiple choice questions. Question number 1. The digoxin increases intracellular calcium concentration. This effect is caused by digoxin inhibiting A. Cardiac phosphodiesterase, B. Cardiac beta-2 receptors, C. Renin release from the kidney, D. Sodium-potassium ATPase of the myocyte membrane. The answer is D. This is the answer. Sodium-potassium ATPase of the myocyte membrane. Second question. A 62-year-old man has acute heart failure and pulmonary edema. Which of the following drugs will be most appropriate to manage his pulmonary edema? Choices are furosemide, digoxin, dobutamine, minoxidil, atenolol. The answer is A. Question number 3. Heart failure is often followed by increased heart rate and renin release from the juxtaglomerular cells. Which of the following drug will be most useful to decrease the heart rate and renin release? Choices are dobutamine, digoxin, metoprolol, enalapril, ambrinon. Answer is metoprolol. Okay, so that will decrease the heart rate and decrease renin release. Question number 4. Which of the following drugs is a phosphodiesterase inhibitor that increases the intracellular concentration of cyclic AMP? Long-term therapy may be associated with a substantial increase in the risk of mortality. Choices are enalapril, digoxin, losartan, atenolol, ambrinon. Answer should be ambrinon. That is a phosphodiesterase. Question number 5. A 61-year-old widower attempted to commit suicide by swallowing more than 50 pills of digoxin. His pulse rate was about 55 beats per minute and an ECG revealed a third-degree heart block. Which one of the following is the most important drug to administer initially to this patient? Choices are lidocaine, phenytoin, potassium salt, digoxin immune fab, DC cardioversion. Choice is D. Digoxin immune fab. D. Question number 6. All of the following are mechanism of action of nitroglycerin except one. The exception is what? A. It constricts the large vein. B. Diminishes preload. C. Reduces the work of the heart. D. Dilates the coronary vasculature. E. Increases blood supply to the heart muscle. What is the answer? Action of nitroglycerin. What is the exception? All of them are correct except this. It does not constrict the large vein, rather it dilates the large vein, it decreases preload, and if the preload is decreased, then afterload will also be decreased. So this is the exception, that is the answer here. Question number 7. Intravenous morphine dramatically relieves dyspnea, there is difficulty in breathing, caused by pulmonary edema associated with left ventricular failure, possibly by its vasodilatory effect. True or false? Answer should be true. A is the answer. True. 7. Question number 8. Which of the following statements about the effects of morphine is correct? Morphine increases blood pressure? No, it has no role in blood pressure, but in high doses even it may decrease blood pressure. Morphine increases heart rate? No, it has no effect on heart rate, but in heavy dose or large dose of morphine may decrease the heart rate. Morphine decreases the cerebrospinal fluid pressure? No, because it dilates the cerebral vessels, so it increases the cerebrospinal fluid pressure. It increases. Okay. Number D. This is also, all three are wrong. Morphine releases histamine from the mast cell. Is it true? Yes. This is the answer. Morphine releases histamine from mast cells. Okay. Question number 9. Sildenafil attenuates the action of nitrates. Concurrent use of sildenafil and nitroglycerin causes dangerous hypertension. True or false? False. This drug is an anti-erectile drug, anti-erectile failure drug used to manage impotence or erectile dysfunction is prevented by this drug. Actually, it potentiates the action of nitrate, and concurrent use of sildenafil and nitroglycerin causes dangerous hypotension, not hypertension. So, it potentiates, not attenuate. Question number 10. Which of the following is a drug of choice to treat congestive heart failure directly related to hypertensive emergency with a rare adverse effect of cyanide toxicity? What is that drug? Morphine, furosemide, nitroglycerin, nitroprusside, nesiritide. What is the choice? Answer should be nitroprusside. Okay. Used to treat congestive heart failure related to hypertension, and it may cause cyanide poisoning. Answer is D, nitroprusside. This is a BNP, brain-based natriuretic peptide. Okay. So our answer is this nitroprusside. Question number 11. Which of the following is the superior treatment in advanced heart failure? Statistically found, we need multiple drugs to manage the advanced or stage 3 heart failure. So we have some regimen, just diuretic, ACE inhibitor plus diuretic, digoxin plus diuretic, digoxin plus diuretic plus ACE inhibitor. So this is the superior treatment for the advanced heart failure. This drug, digoxin, diuretic, and angiotensin converting enzyme inhibitor. This is the superior treatment for the advanced heart failure patients. Okay. Question number 12. Which of the following drug is an inotropic agent, has the advantage of increasing cardiac output without increasing peripheral vascular resistance, and is useful to a congestive heart failure patient with hypotension? Okay. So answer choices are nitroglycerin, sodium nitroprusside, dobutamine, and furosemide. What is the answer? Answer is C, dobutamine. Okay. it increases cardiac output without increasing peripheral vascular resistance? Answer is dobutamine. Number 13. Which of the following drug is a long-acting beta-1 selective antagonist useful to improve systolic functioning, reverse cardiac remodeling, and to decrease cumulative mortality in patients with heart failure? So, choices are acebutolol, etinolol, metoprolol, ismolol. This is the drug, long-acting beta-1 blocker. It is approved by FDA to manage heart failure patients. Question number 14. All of the following drugs decrease blood potassium and enhance the potential for cardiotoxicity, except one. The exception is what? Corticosteroid, verapamil, thiazide diuretic, loop diuretic. Answer should be B. Okay. They decrease blood potassium, all other drug, and enhance potential for cardiotoxicity except the verapamil. Okay. Verapamil does not decrease the potassium level. Question number 15. Increased digitalis concentration may occur during concurrent therapy with all of the following drugs except one. The exception is what? Amiodarone, okay, erythromycin, quinidine, tetracycline, acetaminophen. Out of this all, this drug will not have any interaction with that of the digitalis. All of these drugs will have interaction with the digitalis. Okay, and this is my answer key. And that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends. Have a nice, wonderful, and blessed day. Bye now.